And thank you to all of you for coming. It's an incredibly important issue for Americans all over the country, particularly for folks living in my state. And so I appreciate all of the work that you all are doing here. A couple questions, just really quickly. I think I want to direct this question, if it's okay, to you, Dr. Feldman. Across our country, many families are choosing now between putting food on the table and purchasing those life-saving healthcare drugs and medication, all the things that we have been talking about throughout today's hearing, paying nearly 3 times as much on prescription drugs compared to families in peer countries. Dr. Feldman, as a physician, how have you seen high prescription drug costs not only impact patients, but affect the livelihood and financial stability of the full family?
Thank you for that question. I have. You know, we often think about, as physicians, how these high out-of-pocket costs affect that patient. Are they going to take the medication? I spend a lot of my time when I'm practicing. I work in the medical intensive care unit. We admitted a patient recently who had diabetes and was there with DKA, diabetic ketoacidosis, which can be a fatal complication of not taking your insulin. When I asked her what happened, she said, I just couldn't afford my insulin. And I think as physicians, we're laser focused on the problems for the patient, but there is no question that every dollar that is spent on those high out-of-pocket costs for patients mean $1 less that they can spend on getting food, clothing for their kids, for their loved ones. So I think it's an important point that we probably don't think enough about.
I appreciate you acknowledging it. You're right. There's lots of conversation among practitioners about the patient complying with the medication orders and managing their health and the unintended consequences that making those choices have across the full family, then also potentially lead to the young person not being able to sort of have the resources to meet their sort of full impact in life. So I appreciate you talking about it. Are there particular populations that you think that are disproportionately touched by these kinds of financial burdens, just in the patient population that you've seen or experienced that we need to be thinking about specifically?
All of the issues that we're talking about today have disproportionate effects on the most disadvantaged members of our society. Where do we see the highest rates of asthma, of COPD, of diabetes? It's in already disadvantaged groups of patients. And I think a big motivation for my work is trying to address these problems to resolve some of these disparities. I think we've talked a lot about different proposals. It can feel very lofty, a lot of these conversations we're having about the patent system. At the end of the day, we're talking about expensive medications for people who can't afford them, and it disproportionately hurting certain members of our society in ways that I think are problematic. And
this is a line of questioning that I wanted to get to, because I do think that there's a lot of complexity, as was noted in the first witnesses' offerings. There's a lot of complexity to the systems and the laws as we're and consequences, intentional and unintentional, around the bureaucracy, and so often we can lose sight of the people as we try to navigate the morass of the process. And so I wanted to make sure that for those who are taking an hour to watch C-SPAN, whose issue, but whose lives are very much impacted by the costs of medication, that we give them an opportunity to remind ourselves that at the end of the day, this is about the American people as opposed to the complexity of the process. And so if there was one patient that you could offer their story for consideration, I'd love to give you my last 10 seconds to talk about and offer that one story.
Yeah, I'm thinking about a patient that I saw when I was a fellow in pulmonary medicine. And, it's hard to talk about costs with patients. A lot of patients are embarrassed. People don't want to talk about the fact that they can't afford their medications. But I remember talking with her, and she, rather than using inhalers, which are more convenient, which she could not afford, she was using, cobbling together therapies via nebulizer, which is not something we've talked about, but it's basically where the ingredients are sold separately. And they can work, but her story sticks out in my mind because, number one, it was hard for her to talk about. Number two, she couldn't use the medications that we prescribed. She had to use a medication that takes longer to administer. You have to do it at home. And, it's exactly like I was saying before. The most disadvantaged members of society are the ones who are affected by these patent games. I think if we want to address racial disparities, socioeconomic disparities, we have a lot to do in this country. But everything we're talking about here today is a way of doing that.
Senator Klobuchar.